For jaw surgery, I wanted to talk about the consult and what we usually do in the consult. So we see a good percentage of patients from afar, remotely, and often we'll begin with those patients on an initial Zoom or video visit where any records or pictures that they may have, they send to us, and we can talk in general terms, of course, and think about and see what's bothering them. But ultimately, and for patients that are nearby, we'll want to see you in person for an initial, more comprehensive consult. So during that initial consult for jaw surgery, we do several things. So again, we begin with some of the symptoms that you've been having, what bothers you the most, if there's issues related to your teeth and bite, what types of things you've had in the past, including orthodontic care or therapy, including whether or not wisdom teeth or impacted teeth have been removed or other teeth have been removed, what the structure is in terms of the airway. Is there issues with snoring or sleep apnea? Have you had a sleep study? Have you been on CPAP or tried nasal sprays or had any other surgeries related to that? Medical problems that may or may not be contributing, and sort of what your ultimate goals are, with this surgery. We then, of course, will perform examination, facial examination, look at the TMJs, the bite, the occlusion, the nose, other elements related to the face. And then we bring you to our 3D comprehensive room where we obtain a CT scan, and the CT scan we have is the latest, where we can get the entire face, even the skull if need be, depending on our area of interest. And this also has a 3D soft tissue as part of our CT scan. We can look from all vantage points and planes of space. We can do measurements on the spot. We can look at the TMJs in terms of arthritis, in terms of position of the disc, looking at condylar overgrowth or resorption and how the TMJ might be affecting things. We'll look at the nose and look for septal deviation, valve collapse, positions of the bony components of the nose. We look at the sinuses. We look at the position of teeth, the arch form, how wide the arch may be, if there's impacted teeth, if there's crowding, what the occlusal relationships are, if there's a malocclusion, what type of malocclusion, and characterize this, look at rotations and asymmetries, and then we also will obtain a 3D photo. On that 3D photo, at times, we can do some simulations. So we first understand the existing state, what's out of balance, what is most bothersome, and what we hope to achieve with the surgery. We obtain some regular photos as well. And with all of this data, we're ultimately able to do our 3D plan. We don't do it right then and there at the consult, but we have the data that we can then sit with and manipulate and perform a lot of analysis and assessments. Certainly before the surgery, a few weeks before the surgery, we'll do a very definitive, accurate, dedicated plan, and this will be communicated with you, and it will incorporate all of these elements that we're seeking to achieve, whether it be the bite, aesthetics, airway, opening the airway, and TMJ balance. Most frequently, all of these things are brought together. And then the last thing we do at this in-person consult is talk about some specifics of the surgery that is relevant to you in your specific case, logistics related to the surgery center and timing and scheduling, steps that we need to take in terms of your orthodontist, and then meeting with our scheduler to look at dates and logistics and things along those lines. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.